Medicare Part C is a little bit different than what we've talked about so far. It falls outside the bounds of traditional Medicare and is most commonly known as Medicare Advantage, or MA. Now, like Parts A and B, Part C plans are funded by the Centers for Medicare and Medicaid Services, or CMS. But there are a few important differences with Part C plans. First, traditional Medicare separates hospital and medical insurance into two distinct plans, Parts A and B. Part C combines those benefits into a single plan. Many Part C plans, in fact, also include a prescription drug benefit that's equivalent to the Part D program, which we'll discuss in our next video. Second important difference. While Parts A and B are administered by CMS, Part C plans are administered by private payers. These can include commercial insurance plans like United, Aetna, or Humana, as well as health systems that have built their own in-house insurance arm. Regardless of who's administering the plan, the mechanics of Part C payment, though, are consistent. CMS contracts with these private payers and gives them a lump sum payment. That lump sum is based on things like the plan enrollees' risk scores, how sick they are, local spending benchmarks, and the plan's quality ratings. And that lump sum is intended to cover enrollees' monthly healthcare costs, whether in the inpatient or the outpatient setting. In other words, Part C operates on a capitated payment model, which is very different from the fee-for-service model that Parts A and B are built on. Instead of retroactively paying hospitals and physicians for each service they deliver to a Medicare patient, CMS is offering up a fixed amount of money to the health plans to cover all of a Medicare patient's healthcare needs. If an enrollee's total costs come in below the fixed rate, the organization pockets the savings. But if costs exceed the fixed rate, the organization is on the hook to pay the difference. Over the last decade, we've seen Part C plans rise in popularity, both among enrollees and among the payers and providers that administer the plans. By 2025, about 40% of the Medicare population is expected to be enrolled in Part C. Part C plans often have higher out-of-pocket costs, but they also tend to be more comprehensive in the benefits they offer, which is attractive to many Medicare enrollees. On the plan side, the industry's shift towards value-based care is driving more providers to offer these kinds of plans. In 2016, more than half of the new Part C plans were sponsored by health systems, as these organizations seized the opportunity to take on financial risk for the cost and quality of care. As more providers get hands-on experience with the Medicare Advantage population, we can expect to see more scrutiny over supply and service spending and more efforts to keep enrollees healthy and out of the hospital whenever possible.